Hello everyone. Have you ever wondered if natural herbs could actually help with Alzheimer's or memory problems? You've probably heard of herbs like ginkgo or turmeric, but does the science really back them up? Let's break it down. Simple, clear, and straight to the point. Alzheimer's is a brain disease that affects memory and thinking. There's no cure yet, but scientists are looking into plants because they contain natural chemicals that may protect brain cells. Things like antioxidants and anti-inflammatory compounds are of particular interest. Here's what we are going to cover today. What herbs have been studied for Alzheimer's, what the research really says, and how to use this info safely if you're curious about trying them. Ginkgo biloba is probably the most famous brain herb. There have been many studies carried out. Some show small improvements in memory and daily life, while others show no difference. The main active components in Ginkgo biloba are flavonoids, terpenoids, and ginkgolides. Flavonoids have antioxidant properties, terpenoids can dilate blood vessels to improve blood circulation, and ginkgolides are important for reducing platelet aggregation. The dose used in research was between 120 to 240 milligrams per day, but heads up, it can thin your blood, so not great if you're on meds like warfarin or aspirin. Lemon balm has been used for centuries to calm nerves. In some studies, people with dementia who took it were less anxious or agitated. Smells great, tastes nice, but effects are mild. Best for relaxation, not memory miracles. Sage is not just for stuffing. Some research found it helps improve attention and memory for a short while. It might boost a brain chemical called acetylcholine, the same one Alzheimer's drugs target. Safe in small doses, but stronger extracts should be checked with your healthcare provider. And Huperzine A comes from a moss plant and works kind of like Alzheimer's medications. Studies in China show it can improve thinking in the short term, but it's powerful stuff. It can slow your heart rate or cause nausea, so don't self-dose this one. Bacopa, also called Brahmi, is a memory herb from India. Some studies say it helps healthy adults remember better. This needs more research as we don't have strong scientific proof it helps Alzheimer's yet. It's usually taken at 300 to 600 milligrams a day. I'm sure you don't need any introduction to turmeric, that bright yellow spice. The active compound curcumin helps fight inflammation and might protect brain cells. However, it doesn't absorb well in your body. The solution is to add black pepper. This helps with the absorption. It's safe in food amounts, so keep that curry coming. Traditional Chinese medicine uses mixes of herbs. There are studies that show benefits. Formulas vary as the overall health of the patient is taken into account when prescribing. Always consult a traditional Chinese medical herbalist. So, what's the bottom line? Herbs might give a small boost or help calm symptoms, but they don't cure Alzheimer's. Always check with your herbalist before mixing herbs and medications. Natural doesn't always mean safe. To recap, ginkgo may help memory, watch for blood thinner issues. Lemon balm and sage can calm and slightly sharpen focus. Huperzine A, strong effect, but needs medical oversight. Bacopa, promising for memory. Turmeric, anti-inflammatory, always take with black pepper. Chinese herbs, as with Ayurvedic medicine, centuries of successful use. What is the best approach? Combine, don't replace. Herbs can support brain health alongside medication, exercise, and good nutrition. Think of it as teamwork, science, lifestyle, and nature working together. You will find a list of the research in the notes below.